If you have an elderly parent, then the day is going to come, if it hasn't come already, that they may be faced with a stay in a nursing home. And it's really going to be important for you to have an understanding of the differences between custodial and a skilled level of care. By the end of this video, you're going to have a really good understanding of the differences between the levels, and you're also going to know that it's going to depend on who you ask and when you ask them. So these terms, custodial and skilled level of care, can be really confusing. And honestly, I worked in healthcare for probably a couple of years in the beginning before I really kind of understood the nuances between them and what the criteria were. And then I have to admit, it took even a couple more years for me to fully understand that it really depended on who you asked and when you asked about what level a person was at, because there's more than one level to talk about these things at. So it's no wonder that the families I've worked with over the years can sometimes be not only confused, but frustrated and sometimes really angry because they didn't understand these levels of care. They were frustrated. They didn't understand what staff were talking about. And nobody ever really took the time to educate them on this kind of really complicated issue and the terms and what the criteria were. So I'm hoping to do that today so that it'll alleviate some frustration for you in the future. So today I'm specifically talking about care in a nursing home or a rehab facility. I'm not talking about care in a home environment or an acute hospital setting. I'm going to start with custodial level of care because that's a little bit simpler. So a custodial level of care is when your parent needs help with basic activities of daily living, also known as ADLs. These are things like dressing, bathing, toileting, grooming, eating, transferring, things like that, the basic necessities of care. These are things that you might already be doing at home for your parent or hiring a caregiver in to help out with. And it might be that your parent has a huge amount of need for assistance in all of these areas. They might be bedbound, and it might take a lot of effort and time from the caregiver to provide these services, but they are still considered custodial level of care. A skilled level of care, on the other hand, is a little more complicated. A skilled level of care requires that the intervention be done only by a professional, skilled, licensed person, such as an RN. So maybe your parent needs help with wound care or needs monitoring, specialized monitoring like cardiac monitoring. They have IVs that need to be managed, things like that require a registered nurse to do. Skilled care also often involves physical therapists, occupational therapists, and speech-language pathologists. But just you or your parent wanting physical therapy isn't good enough. Your parent has to meet very strict criteria. So the therapists are going to come in and they're going to assess and they're going to screen your parent to see if they meet the criteria. They're going to screen for things not only your parents' physical capabilities, but also are they motivated? Can they participate? Do they have the mental capacity to understand and follow directions? Are they going to be able to remember what they learned yesterday and build on it? Do they have the stamina to participate in therapy for an hour a day, a few times a week, or even up to 3 hours a day, 5 times a week at some facilities? It's required that your parent be able to show progress. These therapies are rehabilitative, meaning that their whole goal is to get your parent back to a prior level of functioning before an illness or an injury. So after screening, if the therapists feel like your parent didn't meet all of those criteria, they're going to say your parent's not skilled, that they would recommend that they be at a custodial level of care. A lot of families request a therapist to come in and do passive range of motion, which would be like moving their parents' arms and fingers and hands and legs to try to promote blood flow and prevent contractures. That is passive It's not the patient, it's not your parent actually doing the work. It's a staff member doing the work for them. That's not considered rehabilitative. That's considered a custodial level of care. And it does not require a licensed, skilled therapist to do those things. So defining custodial and skilled level that way, based on what their needs are, that's the easy way to define custodial and skilled level. But it gets a little more complicated when you start bringing insurance into it. Let me start off by just clarifying that Medicare or a Medicare Advantage plan will cover a skilled stay in a nursing facility as long as your parent meets criteria. They will not cover a custodial level of care. Whereas Medicaid will cover a custodial level of care on an ongoing basis, but they will not cover a skilled therapy in a nursing home. So the best scenario is if your parent has both Medicare and Medicaid, and they work together to make sure that your parent is able to stay at whatever level of care they need. Now, one thing that's confusing a lot of people is that you hear that Medicare covers 100 skilled days in a nursing home. But that's not automatic. Your parent has to meet the criteria. So I never tell families I work with that Medicare is going to pay 100 days because that's not a given. What I do tell them is that Medicare will pay up to 100 days if your parent meets the criteria for a skilled level of care. And before I go on, there's one other thing that it's important for you to understand, and that is that Medicare or the Medicare Advantage plan is paying a higher skilled rate of pay to that facility to take care of the skilled needs of your parent. A custodial rate of pay is much lower. So even though there are 100 days possibly available to be covered, if, let's say, your parent at day 70 or 40 or even 10 no longer meets that criteria for a skilled stay because, let's say, they refuse to participate in therapy, or they don't have the mental capacity to participate and follow directions, or they've plateaued and they're just not getting any better, then the therapists are going to document that, and insurance is no longer going to pay for that skilled level of care. And the insurance is going to say your parent is now at a custodial level of care. Once all the therapies have signed off and said your parent no longer meets criteria, then the insurance is no longer going to pay for that skilled level of care, no matter how many of the 100 days were used. On the other end of the 100-day spectrum, things can also be a little bit confusing. Let's say your parent has been on a skilled stay, receiving therapy and doing fabulous. They're progressing, they're doing great, and they're approaching their 100 days, but they haven't met their goals yet. And they have great potential to progress even farther, but on the 100th day, that is all the insurance is going to cover because that's the basic benefit. Even if they have a need for more, the insurance is going to stop paying that higher level and they're going to say your parent is at a custodial level, even though their need is a skilled level. So there are two different levels to talk about this at. Does that make sense? I know it's a little bit confusing. I know it's a lot a bit confusing. So at that point, either the 100 days are exhausted or your parent no longer meets the skill criteria, even if it's earlier than 100 days, then the only choice is to discharge home. There is a possibility if their needs cannot be met at home and they have Medicaid, that they could stay in the facility under a custodial long-term care. However, nursing homes, they don't like that. And the reason for that is because there is a normal and expected progression through the healthcare continuum. And when you're in skilled care in a nursing home, the expectation is that your parent is going to go home to be independent or receive care and support at home by family or caregivers. The reason they don't like your parent to go through skilled and then stay custodial is because nursing home facilities are licensed to have so many long-term care beds, long-term care custodial beds, and so many Medicare skilled beds. And of course, they prefer these Medicare skilled patients because they get paid a higher rate. And if one of these patients isn't able to go home and they have to stay in a long-term care bed, there might not be a bed available, first of all. But if there's no discharge plan for them and the patient has to stay, then that throws off all their financials because they're not getting paid what they expected to be paid for that bed. So I just want to make sure you have an understanding of that. So just to recap, skilled and custodial can either be based on your parents' needs, the level of need that they have, skilled or custodial, or it could be also discussed on a level of insurance reimbursement. Is the facility being reimbursed on a skilled or custodial level? So it's really important to ask questions if somebody's talking to you about these things to clarify which are they talking about so you have a good understanding. I know it's still confusing. If you still have some questions, please leave them down in the comments. And while you're here, please don't forget to subscribe so you don't miss any upcoming videos on everything that is senior related, elder care related, and family caregiver related. It's all important and there's so much information. I really thank you so much for watching today, and I'll see you next time.